just one look.
My name is Cynthia Rochester, and I am a prostate cancer survivor. November 29, 2010, God called my husband home, John Sylvester Rochester, just turned 50 years old. And as I was sitting there, I was thinking about all the memories that are in this place. When we got married here. We had our child blessed here. He preached his first sermon here. I remember looking up in the choir as he would sing, and he was always so excited. You could see him from any part of the sanctuary that you would be in, because his excitement would just exude from him. But a couple of years ago, I got a phone call on a Monday afternoon. In that phone call, he said, "Honey, my back is hurting, and it feels like I've got a toothache in my back." And I said, "Okay, I'm on my way to get you. I'm going to take you to the hospital." He said, "Okay." I knew that was a problem right there, because my husband did not volunteer at any time to go to a hospital. I took him to the hospital, and 3.5 hours later, we had a full cancer diagnosis that not only was cancerous, but had already reached his lymph nodes. My husband had prostate cancer. With us being one, with us being married, that also too meant that I had prostate cancer. So between the two of us, I'm the one that survived. But when I asked God, what do I do with this pain? What do I do with the memories? How do I continue his legacy? He shared with me, just spread the news of one of the easiest cancers to treat, but one of the most aggressive if left untreated. Prostate cancer has become the #2 killer among the African American men. In that, it's done it very silently, but part of the challenge is we don't talk about it. We don't talk about prostate cancer. We don't talk about anything that even remotely is connected or just seems like it has anything to do with sexuality. But prostate cancer is not about sexuality. It's about destroying of the family. Prostate cancer took everything that we had. It affected us financially. It affected us emotionally. It affected us mentally. The only thing that it never affected us was spiritually, because we knew that in the midst of all of it, that God had us. So we continue to move forward in that, but all of the other things that it literally destroyed. Never did I think that at 49 years old I would be planning a memorial service as opposed to trying to figure out how to spend the 401k or where we were going to be going on vacation as soon as we got our youngest child in school, into college. Little did I think that I would be sitting alone thinking about the things that we could have done and never did. And one thing that I found out is that the major problem that I had with all this is that I just didn't know. No one ever talked about it. It was an old man disease. I didn't know that an African American man at the age of 40 is to be tested for, the PSA is to be tested, which is prostate serum antigen. It's just a simple blood test. Oftentimes, if there is a family history of it, it is necessary to do a rectal examination. However, the initial screening is only a blood test. One of the other challenges that we have is that we don't talk about it within our families. We don't tell our sons and our nephews and our brothers that their father or their brother or their grandfather has suffered with prostate cancer. So what ends up happening is that they have a family history of it, which takes them at a higher risk, and they don't know. So what I want to do is I want to talk to all the ladies. All of you ladies, we have the power of what I call just a pillow talk. You need to really talk to your brothers, your uncles, your husbands, your boyfriends, your significant others. Get them to get tested. It's very simple, and within a week you can have results that could actually save their lives. But let me tell you a little bit of all of what happened. With John, we got the cancer diagnosis. The next week he started treatment. Within a week and a half after that, We had received a cease and desist order on any sexual activity whatsoever. But the part that didn't bother me because we're married and I loved my husband. What bothered me was the part that came after that, and that was the loss of intimacy. See, it wasn't that my husband didn't love me. It was the fact that the treatment that he was undergoing prevented him, by them lowering his testosterone levels, of having any type of reaction, and I became just his sister or his friend, and eventually became his caregiver and his nurse. So all of the pressure became on me. He no longer could work. He had nephroscopy tubes, which are basically catheters going directly into his back. With that, since they were in his back, I had to be the one to empty and to change them. We often ran into times that we would be in public and they would leak and we'd have to run home so he could change clothes. Later on, we would find out that the continuous infections that would go because of that and the continuous changing. With that, he had lost over 140 pounds before his death. I had lost not just one, but possibly two small people. This man who was 360 pounds, worked out 5-6 times a week, didn't smoke, didn't drink, basically ate relatively healthy, was very active, then became silenced. I had to deal with vomiting of 10 to 14 times per day. Then we started dealing with bowel incontinence. And a lot of people say, well, why do you share that? It's so personal. But we need to take the pretty face of cancer off. We have that romanticized, and oh, that loved one, oh. But the thing is, even though physically my daughter and I didn't have cancer, we developed cancer from an emotional and a mental side. It got to the point that our little girl no longer could have anyone to go anywhere with her because either she had to be there or I had to be there, just in case he were to fall, to make sure that he had his necessary medications, to make sure that he had something to eat. And this went on for over 2 years. With that in mind, it literally ripped us apart, but yet we stayed together. We continued to love one another and we continued to be there for one another. But never did I think that I would have to go through that. And some of you might be saying, well, was it really about you? No, it wasn't that it was about me. But what it was about was the family. It is imperative that we fight for the lives of our African American men. Because if we have strong families, we have strong churches. We have strong churches, we have strong communities. We have strong communities, we have strong cities, strong states, and we can build this country to be what it needs to be. But it's not going to be done unless we take action. We can no longer be silent with this. I'm encouraging everyone that if you know, and just make a list of 5 people, if nothing but just 5, of African American men that are 40 years or older, make that list and make it a point that by the year end that you have each one of them or that you've encouraged them to be tested. Realize how many lives that we could save. The treatments initially are very simple. It's later on that they become more difficult. If I had only known. But the environments that I was raised in didn't talk about prostate cancer. I am now determined that every person that I speak with that knows an African American man, they get to them and they talk to them, encourage them, and possibly even go with them or take them to a healthcare facility, to a doctor, to a clinic, just for a test. Let's save the lives of our African American men. But then we can also be saving the lives of the African American family. Let's keep it strong. Let's keep it together. Let's save our men. My name is Cynthia Rochester. I am the founder of Save Our Men Foundation, and I too am a prostate cancer survivor.
And he blessed my soul, and he blessed my soul, and he blessed my soul.